Okay guys, we're going to do several of our topics in musculoskeletal on Explain Everything. So go ahead, get your book, pen, PowerPoint, and highlighter, and we'll get started. First topic's going to be care of the amputee, and so we're in your Med-Surg book, and we're on page 1530. Okay, so the majority of individuals that are going to have amputations actually are suffering from PAD. So we just finished talking about PAD, and a lot of the people who have peripheral arterial disease also have diabetes. And so over 50% of the people that end up having to have amputations are diabetics, and it's because they've developed PAD. They have chronic tissue ischemia. We talked about this in class with the necrosis, and then the limb becomes gangrenous, and we have to go ahead and amputate. When we're going to do an amputation, really they want to preserve as much of the functional length as possible. Just a couple of the abbreviations: AKA just means above the knee, and BKA means below the knee. But if you also look on page 1531, you can see that there are different types of amputations. Other than the above the knee and below the knee, they just happen to be the most common, and we'll talk about those to the biggest extent. It is imperative preoperatively that we are able to connect with these individuals that are going to have amputations, so we can talk about different things that are going to occur post-operatively. For instance, closed versus open technique. There are times, for instance, when someone has to have an amputation, maybe due to swelling, maybe due to infection. We can't close it immediately, and so they're going to have an open wound. They would need to know this preoperatively. It is best if we can get these guys connected with physical therapy to strengthen their muscles. Just think about it. If you're going to have a lower limb amputation, you're going to be using a lot of upper body strength to transfer yourself, for instance, from the bed to the wheelchair, from the wheelchair possibly back to the bed or to a chair. So it is nice to have pre-op physical therapy strength training. They also definitely should be taught to use crutches or walkers preoperatively, and also talk to them about emotional support, possibly connect them with someone who's an amputee, and talk to them about the pain that they're going to feel, the regular surgical post-op incisional pain, but also phantom limb pain and sensation, which we'll talk about later in the PowerPoint. Is there going to be a prosthetic fitting right away after the amputation, or will they have to wait? And what will be required of the stump care? Will we be using compression bandages? Will there be a specific type of sock that they have to use? These are all things that are best addressed preoperatively. Okay, let's talk about the three different types of possible sensations and pain that an amputee could have post-surgery. First, phantom limb sensation. Actually, 50 to 80% of patients feel like the limb is still attached and that it is burning, it's itching, it's warm, it's cold, the foot is up in the air, it's down on the side of the bed. And there are many theories as to why this happens, why the causes already established, for instance, nerve conduction that the brain remembers, but it is not unusual. Fortunately, over time, it does subside, okay? And so that is something patients need to be informed of preoperatively, that over time it will subside. Then they often, and most often, experience actual stump pain, from where this limb has actually been severed. And so this is the pain that we definitely need to treat. And then sometimes in the amputated limb, there's what we call phantom limb pain. It's different than sensation, than actually feeling like the finger or toe or arm or leg is still attached. They actually still feel the burning, for instance, in the toes that were amputated. And what they find with this is that a lot of times anxiety and stress or weather changes can make this worse, where they still experiencing the same burning sensation or pain that they had preoperatively that led to the actual amputation. So, as far as post-op stump pain, we treat that with opioids. When we need to deal with phantom limb pain, a lot of antidepressants are effective, biofeedback, sometimes spinal cord stimulation, acupuncture, and hypnosis are some options. Okay, so let's talk about this patient post-operatively now that they've had their amputation. We need to be concerned, for instance, with infection. So we need to make sure that we would prevent or detect an infection. We need to make sure that we're very careful to monitor the vital signs and to monitor the post-op surgical site and to make sure that the surgical dressings are changed per the physician's request. We really need to be concerned about contractures, especially flexion contractures, all right? These actually delay rehab process, and so the most common one is a hip flexion contracture, all right? And so in order to avoid this, in order to avoid a hip flexion contracture, we have the patient avoid sitting in a chair for more than an hour and having pillows under their surgical extremity. What we would like for them to do, if possible and not contraindicated, is to actually lie on their belly for 30 minutes 3 to 4 times each day, and this will also help prevent contractures. And we've talked about chronic stump pain and phantom pain previously, all right? Now, as far as the disturbed body image too, it's important that we talk to them about their prosthetic fittings preoperatively. Some people have immediate prosthetic fittings, others have delayed, and some are not candidates for prosthetic fittings. When people are candidates for prosthetic fitting, it's important that we shape and mold their stump so it does have a better fit. And we often do this with applying a compression bandage. And this is initially worn at all times except for during physical therapy and when they're bathing. And so it's taken off several times a day. It's wrapped very snugly in a particular manner. For instance, on page 1533, if you look at page 1533, you can see where it shows you the figure 8 wrapping for an above-the-knee amputation, and this is just so there can be a good round stump that will fit well into a prosthetic device. Then you can read on page 1533 the caregiver the patient and caregiver teaching guide, and it just walks you through what you need to make sure that you do following the amputation.